Good afternoon, and thank you for joining us for 22 News at noon. I'm Taylor Knight. Right now, joining us to give us some perspective on the coronavirus is Dr. Mark Keroack, President and CEO of Baystate Health. They join us live in the studio.
Thanks, Taylor. Well, here we are, Dr. Keroack, talking about this coronavirus, which has seemingly touched every part of the globe, including Baystate Medical Center. Now, we reported this morning that, and it was from Friday's numbers, as a matter of fact, about 24 possible cases, one confirmed case at Baystate, but 24 possible cases. You say those numbers have changed since then. Tell us about that.
Yeah, it's strange times, Rich, and really appreciate your having us here. The numbers change day to day. Thus far, we've done 101 tests for the COVID-19 coronavirus. 44 of them have come back negative. One has come back positive. We're still waiting on 56. And so those are in the suspected category. Some of those patients are in the hospital on isolation because they're too sick to quarantine themselves at home.
So far, just one confirmed right now.
Just
but you're
one
waiting
confirmed
on
positive.
These other tests. The one problem about this is that because we're right in the middle of flu season as well, and the symptoms are so similar to the flu that we really do need that testing to figure out who has coronavirus and who has the regular flu.
Right. This virus did not make it easy on us. There are some viruses that have a distinctive look and feel. If you have measles, you have a distinctive rash, or chickenpox, you have a distinctive rash. Coronavirus looks like any other cold or flu. As a matter of fact, there are coronaviruses that were around years ago and still circulate that are not this particular one. But it looks like any other case of the flu, which is why it's tough to pick out those cases when you're in the midst of an epidemic of other viruses as well. It is the winter, and it's the usual time that, excuse me, that flu does circulate.
We all have the danger of being infected, but unfortunately, there are some people that are more susceptible to a serious infection, that is the elderly and also those with immune systems compromised, and that's who we really have to protect. You can't just look at this and say it's not going to get me or I'm going to be fine. You really have to, as we had talked about earlier, it's all about teamwork, not only from the hospital standpoint, but from all of us around here. We have to work together to beat this.
Yeah, it's the amount of susceptibility is just universal. This is a brand new virus to humanity, so every one of us is at risk to get it. And certainly within populations like in China and other countries, 20–30% of the population ended up being infected until there was enough immunity for the thing to die down. Excuse me. But the people at greatest risk of being severely ill are going to be elderly and frail. About 80% of people will just get a mild cold or a mild flu and just get over it, and then they'll be immune. But during the time, even before the time they get sick, they have a lot of virus in their nose and mouth, and they can pass it on to others who might not be as lucky to have a mild illness.
So you could not show symptoms and still be essentially a carrier.
Correct. And that's been well demonstrated in a number of the outbreaks, which is why this virus is so sneaky. It can pass itself around from person to person without people showing any signs of illness.
So how do we, obviously we have these guidelines, not only from the federal government, also the CDC. Governor Baker saying that groups of 25 or more, we're not going to have that happen for the next few months. The CDC says groups of 50 or more for the next 8 weeks. These are ways to try to flatten that curve. That's what's most important about this. We know there's going to be infections out there, but we're trying to flatten that curve, and that's where social distancing comes in.
Right. This whole set of recommendations about not being in crowds or not doing handshakes or hugging or whatever usual ordinary things have all been put in place to limit person-to-person transmission. People can pass this on through either coughing or sneezing. The spray that occurs as a result of that usually goes about 6 feet, which is why that 6-foot rule has been put in place. In addition, touching your nose and mouth when you're infectious and then shaking hands or hugging someone, you can pass the virus on to them. There's also some evidence that it may exist on frequently touched surfaces as well, which is why people are careful about disinfecting things. So all of these are basic epidemic control measures that are as old as the hills, but they are effective. and they're going to have to be the only thing we do until such time as we have a vaccine or a treatment, which may be months to years away.
Yeah, that vaccine might still be a long way off. It might not help
Very
us
likely.
this year.
Very likely not ready this year. What happens with these epidemics, the way all of the viruses where we don't have treatments is, enough people get the mild illness, they get antibodies, they get immune, and then the virus doesn't have as many susceptible targets, and it just kind of dies out on its own.
There's a lot of questions about how long this will actually last. Most flu seasons end when it starts to get warm outside. By the end of spring, start of summer, that tails off, and then we have to worry about the next one when it comes up again in October. We don't know enough about this yet to think that this may or may not stop, right?
Yeah, it's in uncharted territory. I think that a typical respiratory virus will come into a community, it'll last 6 to 8 weeks, and then it'll taper off and go away until maybe coming back the next year or with a slightly different variation. We really don't know, and remember, a lot of what we're trying to do is to slow this down. So if we're very successful at all of this social distancing stuff, we may make it a longer but lower frequency kind of problem.
I had talked about this during Mass Appeal 2 as well, hearkening back to the Spanish flu back in 1918 and the differences between what happened in Philadelphia and what happened in St. Louis. In Philadelphia, they held a parade when the virus began to come back. It actually had been out in the spring of 1918, then kind of died off, and then came back in October of 1918, and Philadelphia was holding a parade to raise money for the war effort, to raise money for war bonds. So they insisted on holding this parade, which 200,000 people attended. St. Louis distanced that themselves. They canceled all that kind of thing, those social gatherings. St. Louis did not have the outbreak like Philadelphia did. In Philadelphia, like I said, they held this parade, and the infection became so bad that people were dying at the rate of 1,000 a day in the streets of Philadelphia.
Yeah,
and literally, you could be healthy in the morning and dead at night. It was that fast. It was a bad situation. Now, because of increased health care and because of state-of-the-art medicine that we have now, we should hopefully never have to face what happened 100 years ago.
Right. The pace of coronavirus is nothing like that deadly flu epidemic, but it can get to be pretty serious after several days, particularly in people with underlying lung problems or the elderly. But I think you raise a good point. We really need to learn from the other areas in the country that have had these experiences. China, Italy, Spain is coming up fast. Britain and Germany are starting to see more and more cases. And the problem that many of these countries had is that they didn't realize that it could be spread so easily between people with minimal symptoms. And so the virus got to be widespread in the community in a kind of sneaky, under the radar way, and then suddenly began to infect people who were very susceptible, such as the elderly. And it occurred with such suddenness that just overwhelmed the health system.
And we see those outbreaks that happen in the United States, whether it's Washington State, New Rochelle, New York, or even in Boston, with that Biogen conference meeting, where a lot of people were at that meeting at the Marriott Wharf, I believe it was.
Yes, and one person infected upwards of 70 individuals.
And that's where most of the cases in Massachusetts anyway happened.
But I think we need to remember that although we're reporting about 164, I think was this morning's tally, cases in Massachusetts, nobody believes that's the real number in terms of actual infections. They're probably easily 10 times that number that we just don't even know about.
And that's why the testing is so important. That's why we need to get the tests out there and why people need to get tested. If you have symptoms, we talked about this before, if you have symptoms, you don't want to swamp the health system. If you feel like you have it, give people advice on what they should do. If they feel like they may have it, they should not go to an ER or hospital, right?
Right. Well, let's assume you had just a mild cold or the flu, stuffy nose, cough, a little bit of a fever. You ought to be calling your doctor to let them know what's going on, or if you don't have a doctor, calling an urgent care center. What we have done at Baystate is to develop a step-by-step set of questions that will determine, are you well enough to stay home, or are you sick enough that you really ought to get in? If you had, severe fevers or shortness of breath or other kinds of symptoms, the sort of thing you might call 911 for, then obviously you don't want to sit home. But what we're trying to do is limit the spread of this disease, we're really very concerned about our employees, the caregivers who are on the front line taking care of these patients. They are geared up and they have been fearless in stepping up to the situation, but we really want to be able to take care of them because we're going to need them to be in the fight for a prolonged period of time too. So for the folks with minor illnesses, the advice is please stay home, don't go to work, don't do social things, just hunker down until you're better.
The good news is, and I think it keeps getting forgotten about this whole thing, is that 98 to 99% of people who actually contract the virus will be fine. They'll be able to survive. Is that those numbers
That's a little
are correct?
bit high. I think that what I've seen, the more you test, the more mild cases you see. Currently, people are saying that at least 80% of people are going to have very mild illness. Maybe 20% are going to be sick enough that they may need to go to the hospital or the emergency room, and then 1 or 2% might actually die.
So that's basically 98 to 99% should
Survive.
recover.
Yeah.
Should recover.
But you just as soon avoid that long stay in the hospital if you could as well.
Yeah. Now, how is the hospital preparing for what could be an influx of patients?
Well, we started screening patients back in December. Once these first cases came out of China, we have a special pathogens team that came together. This group first formed around the Ebola epidemic in 2014. So we started screening patients at the front door as to where they had been traveling, et cetera. Back several weeks ago, we set up an incident command center with Dr. Andy Artenstein in charge. He's our chief physician, who's an infectious disease doctor with a background in biodefense. And he basically leads a team of individuals, and every day they look at current information, the current guidance, issues that the front lines are reporting. We have developed the screening stations to bypass the emergency room. We've opened a 12-bed unit to isolate patients who are confirmed, and we're looking for other units to open, expecting that we're going to be dealing with a large number before this is done.
You're looking for heroes among us, and it's the nurses and doctors and researchers who are frantically working against this virus and the spread of it.
I think that, as a person who dealt with infectious diseases, I was on the front lines of HIV and AIDS in the 1980s and 90s. And it is scary to have an unknown infectious agent. We're pretty sure here's how you protect yourself, but nobody's 100% sure. And so I have great admiration and have been extremely impressed by how willing folks have been to step up and care for their own neighbors in the community. It's really quite heartening, and that's why we're doing everything we can to protect them.
And you feel like once you're infected and once you recover, you should be virus-free at that point, right? It shouldn't come back.
The other coronaviruses, the ones that just cause colds, there is immunity that people get, and they don't get that virus again. There is some question about this virus as to how long the immunity would last. It is one of those viruses that doesn't faithfully make copies of itself, like the flu, and so that it may change its stripes slightly as the years go on. But I expect that, 2, 3, 4 years from now, coronavirus is going to be part of the woodwork. It'll be one of 20 or so viruses we test for. Maybe it'll be part of the routine vaccine, like you'll get a flu plus coronavirus vaccine every year rather than just a flu vaccine. So, but we'll adjust and adapt to it once we have time. What we don't have now is time, and that's why we have to use all these kind of old-fashioned stay away from people, stay away from crowds strategies.
I go back to 1918 once again, and how horrific the month of October was in Philadelphia in 1918. It turns out, though, that people were dying at a rate of 1,000 people a day back then. By November of 1918, like the middle of November, the virus had virtually left the city. And I've heard that the virus can mutate by itself and suddenly become a lot less virulent.
It can. The flu virus is the expert at this because it mutates at a very rapid rate, which is why the flu vaccine from one year doesn't work in the next year because it's already changed over. The coronavirus does this to a certain extent, but not nearly at the rate that the flu virus does. But it wouldn't surprise me if some variant of the coronavirus was around. And many times these viruses do adapt to their human hosts and take on more minor kinds of illnesses, but we're not nearly there yet. We're still, very worried about the elderly and people who have chronic conditions. And one of the things I worry about is, now that we've told everybody to stay away from everybody, who's going to be checking on the senior citizens?
We have to do that.
We have to do that. We have to really stay together as a community, even though we're physically having to separate. So very important to call people who are elderly, neighbors, family members, make sure they're doing okay. Maybe do something like shop for them so that they don't have to go out and about and expose themselves. But small acts of helpfulness and kindness to the elderly, and really trying to allay the anxiety of people around us. I think young kids are going to be somewhat mystified that they're home from school and because of this strange infection, and probably need to be assured by their parents that this is not a disease that hits children. And there have been relatively few cases in younger kids.
That doesn't mean go to parties with a bunch of kids either, though.
Well, I think kids may still get infected and spread it around, which is why you're worried about the people that might finally get sick from it. The governor was pretty clear about that in his conference yesterday, that just because we've canceled school doesn't mean it should be a big play date for everybody.
And maybe it's a good idea also not to stay cooped up inside all the time. Go out and get a breath of fresh air. Maybe open the windows. I know allergy season's here right now, and you got to worry about that as well. But take a walk outside.
Well,
keep your distance, but take a walk outside. And
it's funny you should mention that. I was walking on the rail trail in East Long Meadow yesterday, and there was a whole bunch of people out, a lot more than I usually see. And it was nice to just say hi to people and greet them and whatever in a socially distanced way, but it still created more of a sense of solidarity and togetherness than if I had sat at home and watched TV.
give us your advice. As doom and gloomy as this all sounds, give us your best advice to people to allay their fears and let us know that there is a light at the end of this tunnel. It's a pretty long tunnel right now, but there's a light at the end of the tunnel if we all work together and really, as you mentioned, just be a team.
Yeah, this is a serious situation. We all need to take it seriously, but how bad it's going to be really depends on us, and I mean the big us, the community. If we can really come together and observe these things, which may seem silly to some people, we can make this less of an issue, maybe slow it down and even lower the number of cases, and allow the immune systems of the people who have got the mild infections to work and build a level of protection for us as a community. It's a real test for us to try to come together and do something as a group that is going to help the whole group. I expect that after a couple of months we'll see cases wane, and as we get into the summer, I suspect that this will be an unpleasant memory. And that hopefully in years to come, either it's not going to rear its ugly head or that we'll have a vaccine to protect ourselves.
Let's hope so, Dr. Keroack. Our fingers are crossed. And we really appreciate you joining us today.
Well, thank you for having me. I appreciate being able to get the information out there, and I really appreciate Channel 22's work in keeping a spotlight on this.
Well, we appreciate it as well. Thank you, Dr. Keroack. Dr. Mark Keroack is the President and CEO of Baystate Health. We appreciate you joining us today. And we'll continue with 22 News right after this.